Good afternoon. I would like to welcome all of you in this afternoon session about the presentation of the posters, of the abstracts that are sent to our summit. We will have 1 hour to discuss the 16 posters. Anyone can visit the on-demand part of the website to view the videos that all the participants have prepared and is now uploaded. And now we are planning to have a short dialogue with each one of the presenters, so as you will be able to have a better understanding of the research and of the findings. Any question, any comment is welcome to be addressed to the presenters. We are starting with number 12 poster, and then we will follow the normal series of the posters. So I would like to ask Dr. Almas Arman from the Academy of Preventive Medicine, Kazakhstan, to give us a short abstract, a short summary of his work and the main findings. So, Almas.
Okay. Thank you so much. Yeah, my name is Almas Sharman. I appreciate pushing the schedule a little bit ahead. So I am representing Academy of Preventive Medicine of Kazakhstan. I'd like to acknowledge the contribution of my colleagues, Dr. Vladimir Arnautov, Irina Yermakova, Gulnara Tulybekova, Aysulu Bekjanova, Elmira Yerenchina, and Satar Iraliyev. And the study is that we presenting is the final results of the 5-year follow-up cohort study of respiratory function, physical capacity, and metabolic syndrome components in users of combustible cigarettes and heated tobacco products. So specifically, we studied users of IQOS, that is probably the most prevalent heated tobacco products in Kazakhstan. So we all know that chronic obstructive pulmonary disease is one of the leading causes of illness and morbidity, mortality worldwide, and it is a fourth leading cause of death in Kazakhstan, and one of the most important risk factors.
Your findings.
Yes.
Your findings.
Okay. All right. Okay. Quickly. So we studied 1,200 participants, of which about 400 users of heated tobacco products and 807 combustible cigarettes, age 40-59. Those who smoke minimum of 10 pack years smoking history, and they were recruited over the course of 5 years. So what we came up with is that the comparison of smoking behaviors between conventional cigarettes users and heated tobacco product users revealed that the marginal means estimate for COPD assessment test, so-called CAT score, was 0.465 points lower than those who use heated tobacco products, specifically IQOS. And additionally, what we observed is that FEV, which is force expiratory value, indicated a 0.026 high value for heated tobacco products. So these findings basically suggest that transitioning to HTP use may have less adverse effects than continued use of combustible cigarettes for individuals with a long-term smoking history. So future research should focus on extended follow-up on this cohort to explore the impact of shifting to HTP on both existing and emerging chronic conditions, as well as various health-related measures and outcomes. So we came up with these conclusions, and we believe that we do need more in-depth studies. And currently we are contemplating embarking on more further analysis, including assessment of chest computed tomography data, exacerbation frequency, which was expected primary outcome, biomarkers that we also assessed, and other relevant factors. And this is very crucial to comprehensively assess the difference
Almas.
between. Yes.
Thank you very much. Please try to. Thank you very much. There is no time for questions. So Almas, thank you. Please try to keep the time shorter so that we can discuss your findings if possible. So after this presentation, we are returning to poster number 1. So I would like to ask Svetlana Valerievna Gridneva from Russia to present us the findings about psychological tobacco addiction.
Good afternoon, dear colleagues. I speak English so speak only in Russian. И Александр, надеюсь, поможет мне в переводе.
Good morning, dear colleagues. I would like to assist Svetlana in English language because she don't speak well. So I would like to translate.
So please, 1 minute, the main findings of your research.
В 1 минуту в краткости рассказать, ваш тезис.
Я поняла. Если коротко, то
If briefly to say,
наша основная мысль заключается в том, что...
Я не буду не успевать, да. If briefly to say, our main point of our study is...
В представлении совместной работы кардиолога и психолога
our scientific team are collaboration of psychologists and doctors as cardiologists
с пациентом или клиентом с табачной зависимостью.
We had approach in our study with client of tobacco addiction.
В нашей стране это уникальный случай.
It is very actual for our country to work with tobacco addiction. И в краткости, что?
Нам удалось, благодаря методу когнитивно-поведенческой терапии и медицинской поддержки кардиолога, добиться того, что наш пациент отказался от табачной зависимости.
Our patients refuse smoking only because we had this individual approach, dual addiction psychology, and the support of cardiologists. So it's briefly to say about our presentation.
Okay, thank you very much. Thank you very much. There's no time for questions, so we are now going to the abstract number 2. I would like Baron Kolud from University of Kuwait to present his findings on nicotine supplements and heat tobacco products, phase media ban and negative backlash in Kuwait.
Okay, I hope that you can hear me, my dear. Can you?
Yes.
Okay, so my name is Khulud Baron. I'm from the University of Kuwait in Allied Health, but I will speak today as an editor, as someone who is writing in the #1 Kuwaiti newspaper and having problem in increasing the awareness of tobacco reduction products. Now, in the video, I presented the scenario that when I started talking about this in the media, I was first, I received negative feedback and then I was stopped. And because I am working now for more than 15 years as in the public awareness, health public awareness, I was pushed, or you can say pushed even, to publish that all of the products, especially vaping, all of the products that reduce tobacco are worse than cigarettes. So I presented in this video, I wanted to know the feedback and the if people can tell me how to increase the awareness in an atmosphere or in a country that will, they don't want to hear about it. I presented a lot in the video, so I would like people to go and look, and I'm waiting for your feedback.
So thank you very much. This is a typical way that many countries are behaving. So it is not a surprise, but it is interesting to know it and register it. So the next abstract is presented by myself. It is called Electrodynamic Fields are Reducing Tobacco Products Toxicity, an Innovative Method. So very briefly, in the video, we are introducing a novel method employing electromagnetic fields. And with these electromagnetic fields, we are treating the final products, the cigarettes, the combustible cigarettes, or the vaping products. And we are comparing the results in animal studies about the toxicity and the harms produced either by controls, by non-treated combustible cigarettes, or by these electromagnetic fields treated cigarettes. And we have seen that the animals are presenting reduced lung abnormalities comparing to the typical combustible cigarettes. We have reduced toxic emissions, and the oxidative stress which is caused to the animals is much decreased. So we expect that this way of treating cigarettes can be used to produce tobacco harm reduction products with an innovative method. So I would like to ask the audience and all of you to visit the video and see what is the finding that we are presenting in this abstract. So since there is no question, we are moving to poster number 4, which is presented by Ben Weber. So Ben, please unmute.
Sorry.
Yes.
Can you hear me now?
Yes.
Bengt Weber is my name, and I'm an MBA from Sweden. I'm also a nicotine and snus pouch inventor. And we have made a survey with more than 1,000 participating Swedish male and women, asking them about what they like, what is their habits, etc. And one of the questions was that how do you feel when you use a nicotine pouch about the stinging sensation? And 2/3 of the women and 55% of the men find that the burning sensation is something which they don't like. And when we look out, we have done empirical tests on vapors and smokers from perhaps 40 nations. And when they have tried these products the first time, 9 out of 10 continue smoke or vape because they can't stand this burning sensation. I have patented in the United States and every country in Europe a solution to this by incorporating an integrated mechanical biofilm shield for the gum, which reduces the stinging sensation and also reduce irritation. But it doesn't stop there, because we have this spring done a clinical study with 23 Swedish snus and nicotine pouch using dentists. with some fantastic results. Independent dentist studies in Norway and Sweden have shown that about 70 to 90% of all users of snus or nicotine pouches suffer from oral mucosal snus lesions in the oral mucosa. And so was the fact with these dentists. 95% of them had lesions before switching to my innovative pouches, sting-free snus, for 5 weeks. And we saw reduction in the with 30% in the number of dentists who had lesions turned to not having lesions, and the lesion severity grade was reduced by 56%. The occurrence of gingivitis, which is gum inflammation, was reduced with 100%. So these products do cause oral health problems, and we plan to make a genuine study, randomized trial, controlled randomized trial within a year. We already had some interest from University of Newcastle Dental Science Divisions and the University of Rochester in New York to pursue this. But
Hey, Ben, just a quick question, if you may. Is there interest for this innovation by the companies? Are you discussing with the big companies or not yet?
I'm not at liberty to say.
Okay.
But
So,
we
hope that this will find its route to the market, because it's very important.
Everybody to watch the video, because we are proving the concept in Sweden now, and for those of you who to read in the media, oral health is it's about the last problem, you could say, with these very safe, less harmful products like nicotine pouches.
Yes,
which
we know. Okay,
snus and nicotine pouches has made Sweden almost smoke-free.
Yes, we know it, and we admire you. I mean, the Swedish. Thank you very much.
My last little point was that the use of nicotine pouches is very much gender discriminative, because scientific studies in England, for example, have shown that only 1 out of 5 persons are women. So there, I advise everybody to look for the things that deters also smoking women from switching to safer products.
Okay.
Thank you very much.
Thank you very much. We are moving to abstract number 5. It is from the presenter is Pranit Valodia from South Africa.
Thank you so much, Chair. As indicated, I'm from South Africa. Currently, the tobacco bill is in our parliament. It's called the Tobacco Products and Electronic Delivery Systems Control Bill. And I'd like to present a little about this. So we've had public hearings regarding the bill in 7 out of our 9 provinces. So the process is not completed. And of that, the Portfolio Committee of Health of South Africa, it's a parliamentary committee. They have produced a report, which we call a legacy report, on the public hearings. And I would just like to very briefly tell you what the outcome of those public hearings were. There were 5,373 people who presented orally at the public hearings. And I would say about 46% supported the bill, and 47.2% rejected the bill. So there was an equal number of people who supported the bill and rejected the bill. I must say the bill is certainly not in favor of the electronic devices. Okay, let me. So the bill also commented, or the report commented on those who supported the draft bill, and also those who are against the draft bill, and all the reasons are in the presentation. I don't have time to go through all those reasons with you right now, but I think the report that was produced by the government, called the legacy report, was a very fair report. There was also issues on the flaws in procedure and the public participation process. So there's an issue regarding that, which I am sure will be discussed in Parliament. So my concluding remarks. I think that there's minimal scientific merit in the report as it's produced by the public. I think what should happen going forward is that scientific information should be taken into account, and there should be greater cross-examination of scientific evidence by experts from all the parties concerned, and that has not occurred as yet. And I hope that this will be the way forward. The government should notify why certain decisions were made. And at this point in time, we're not
When
aware.
the decision is about to come?
Very soon.
By the end of the
It's
year?
still in the Parliament, so we're waiting for Parliament to say exactly what process they're going to follow, taking the bill to the next level.
So thank you very much. Good luck.
Thanks.
Good luck.
Thank you very much. Appreciate that. Thank you.
We know that your country is discussed a lot in the Tobacco Harm Reduction Forum. We have heard about it, so we know, but it is very nice that you make it known even more. So we are moving to poster number 6, Sergei Gordeev from the Russian Cancer Research Center.
Hello, dear colleagues. Good day. I was expecting this lecture to happen 1 hour before as in later, so I'm sorry, I'm already in the surgical theater. So what we really did is we did a very small study, which required just to draw attention to the problem of cessation of tobacco smoking and colorectal cancer. As a member of National Guideline Committee, I believe that we publish annual guidelines for the last 10 to 15 years, but we don't mention smoking there. And I believe this is an important question which needs to be addressed. So a small study was just we questioned all of our inpatients in our surgical departments, our surgery about their smoking habits, and we found that about more than half of them were either former or current smokers. And now we implemented last year the tobacco cessation counseling during the routine work in our clinic on the outpatient base. And the patients who received counseling, a lot of them, they started to quit smoking quite fast. And some of them were very heavy smokers. And we also experienced some problems like pulmonary obstruction and psychological problems in patients who quit heavy smoking right before surgery. So they wanted to stop, but they experienced some problems like pulmonary obstruction. And this was an issue for us during the postoperative course. So I believe that the smoking counseling should be implemented early. Because a lot of those patients, when they're newly diagnosed, we work in a tertiary center, but their diagnosis is usually done by their family doctors. And this is the stage when the smoking counseling should be implemented. So that the patients who quit smoking should do it not directly before surgery. And we need more attention at national guidelines to quit smoking, but to use some risk reduction programs to help patients quit smoking step by step and not directly just quit the habit. So it's just a very simple study with the questionnaire for inpatients.
Okay, well understood. Thank you very much. We are continuing. Sorry for this confusion. It happened to many.
No, thank you. I was glad to join the meeting.
It's difficult when the conference, is international to make the exact time known so easily. Thank you very much. Enjoy.
Thank you. Thank you.
Now we are quickly moving to poster number 7, Yulia Yufereva and Daria Regusevskaya from National Research Medical University from Moscow. So, Daria and Yulia, we are listening to you.
Perhaps you can't see me and you see only Yulia. Okay, I should tell somewhat about our work. We perform not study. This was a little literature review about possibility of using current forms of smoking, modern forms of smoking, in situations when when patients need to quit. So these forms of smoking is not completely safe for all peoples, and they are especially unsafe for teenagers, young people, pregnant women. However, in real life, there always be some patients who cannot smoke completely, and patients who cannot or do not want to use nicotine replacement therapy. And often strong recommendation to stop smoking completely in these patients not work, and perhaps we should be more flexible with these patients. And switching to less harmful forms of smoking may be the only way to at least slightly reduce the health risks. And we should warn these patients about the risks of developing long-term dependence, and we should encourage to quit completely all forms of smoking, and electronic cigarettes and heat-not-burn products.
Okay.
That's all.
Julia, Daria and Julia, are you in contact with Sergey?
No.
No.
Now that you can understand that in a neighboring center, they are trying to help the colorectal cancer patients to quit smoking, because it is very, very important for their health and for the after surgery follow-up. I suggest that you try to make a collaboration to help them for stopping smoking in the patients. Okay, thank you very much.
Thank you
for the presentation. And we are moving to poster number 8, which is which will be made by Evangelos Dogos.
Yes.
Okay.
Yes.
So Evangelos
Dogos. Okay.
Vangelis.
Thank you very much, Professor Poulas. Greetings from beautiful Veria. I know you are in Patras, which is beautiful also beautiful. Aim of our study.
More beautiful.
All Greece. I agree. Aim of our study was to identify factors associated with night smoking and the assessment of treatment outcomes. We studied a total of 653 cigarette smokers who received treatment at our smoking cessation counseling center. Data were collected from the medical records as well as from a questionnaire which included Fagerstrom's test. Also, as for the results, about half of them, 49.7%, reported that were night smokers, which we considered as night smoker the person who waking at night for smoking at least once per week. Out of the sample, about 33% reported smoking accident at 6 months follow-up, about 33% only. As for the factors associated with night smoking that were statistically significant, were a large amount of cigarettes, over 30 per day, use of antidepressant drugs, history of vascular disease, stroke, or COPD, Fagerstrom test score over 8, as well as lower socioeconomic status. And for the treatment outcomes, the factors was statistically significant for continuing smoking. Beyond night smoking was the age over 25 years, age of first cigarettes over 35, as well as a large amount of number of cigarettes per day over 30. Finally, night smokers reported a shorter average time to relapse, 42 versus 63 days for the non-night smoker group. In conclusion, night smoking is a significant indicator of nicotine dependence and the marker of more intensive and sustained treatment for smoking cessation. Thank you very, very much.
Vangelis, have you published these findings?
Not. We are intended to do it.
Yes. Very interesting, the night smoking, observation. And you should also check if someone is waking at night because he's a heavy smoker, what is happening with him or with her or with it after turning to tobacco harm reduction products. So you should make a better publication if you compare the traditional combustible smokers with those who are turning to tobacco harm reduction products. If they stop waking up in the night, for example, I don't know. You should think of checking it, okay?
Yes, of course.
Thank you very much. Thank you very much.
So
we are now going to poster abstract number 9. So I would like to ask Sebastian Soulet to make his short presentation about the findings of the research.
Yes, thank you for the introduction. With my colleague Roberto and Sussman, we are currently working on critical reviews of the literature on the analysis of aerosol generated by ENDS. And our aim is to highlight that most of the publication are doing experiment using now high-powered device under conditions that are irrelevant to normal usage. And one consequence of this misunderstanding on how these devices are used is that you generate a significant amount of toxic, aldehydes, and also you have the emission of the pyrolysis of the cotton which is inside the wick. So under these conditions, the aerosol generated is significantly more toxic. And what we want to highlight is that this is a systematization of any laboratory testing, and this misunderstanding and misusing of the device is going deeper. It's not only focused on aerosol, it's also what we also want to highlight is that it is used for in vivo and in vitro experiments. So we are mainly physicists, so we mainly consider the phenomena and how the phenomena occurs. And what we want to raise is that there is a poor interest on the vaping product itself and how they are used. There are a great interest to evaluate and to focus on their toxicity. And there is a bias because you miss to understand. And our main message, and I will stop there, is to consider that vaping products are closer to cooking, and we had to find the analogy is very useful to understand how some condition are irrelevant. And the last example, and I will stop there, is that should we consider that you daily cook chicken with your oven at 500 degrees? I think this is irrelevant, and this is what is usually considered for vaping products. They are tested under irrelevant condition, under the worst condition, and this is a systematization. Thank you.
Okay, Sebastian, thank you very much.
You're welcome.
Say my greetings to Roberto.
I will try.
We are co-authors in a very interesting paper, much discussed some years ago. So thank you very much for the presentation. It is well understood that many of the papers in the literature are having fundamental errors. So we are now moving to abstract number 10. And I would like to ask Konstantinos Partsinevelos to present his finding, representing this very interesting team of researchers.
Thank you, Professor Poulas. I'm participating in the replica project in which University of Catania is the leading center. Last year, we replicated the publication of Fetterman and colleagues of 2018 on the effects of vanillin, a very popular flavor used in e-liquids on endothelial cell function, evaluating cytotoxicity, oxidative stress, and nitric oxide bioavailability. In their experiments, Fetterman and colleagues did an extensive use of ethanol to solubilize vanillin and also as a vehicle of vanillin, and they also performed an unusual exposure using a furnace where the vanillin was added drop-wise into the heated area and aerosolized. In contrast, we used standardized methods, including real e-liquids, commercially available e-cigarettes, and ISO-compliant vaping machines in order to verify whether the results were reproducible and applicable to real vaping experiences. About the results, Fetterman found that vanillin has deleterious effects on endothelium viability and function. On the contrary, our results show that the effects on the cells that Fetterman found are predominantly due to the ethanol presence. That also demonstrates that for reliable results is also absolutely necessary to consider carefully the experimental methodology. Thank you.
Konstantinos, thank you very much. Have you published these results yet?
As a preprint.
Okay. So we're expecting the peer-reviewed...
the publication, yes, of course.
Thank you very much.
Thank you.
So say hello to all the team and to Catania.
Okay, thank you very much.
So now we are moving to abstract number 11, and I would like to ask Marina Peredelskaya from the Allergy and Immunology Department of Russian Medical Academy to present shortly the main findings.
Hello, dear colleagues. And the last 15 years, my research project is about tobacco smoking in different people. And now my research project is about how to about bronchial asthma and different types of cigarette or not cigarette smoking. And you know that bronchial asthma and classic tobacco is a very big problem because, for example, if a patient with bronchial asthma is smoking, for that patient, decreasing inflammation, anti-inflammation effects of corticosteroids, and that patient more rare goes to the emergency because more often goes to the emergency department. And now my research project is about types of inflammation. I want to interest in which inflammation profile in patient with bronchial asthma who use electronic nicotine delivery devices and electronic tobacco heating devices and classic cigarette. But we start our project. We want to include 100 patients, but now we include only 15 patients. And I can to say that a very interesting fact. Patient with bronchial asthma is smoking. They smoking same in the same percent same in the population. But my patient who smoking with asthma, they smoking 2 or 3 types of nicotine delivery system or classic cigarette system. For example, a patient with asthma can smoke classic cigarette with vapes or classic cigarette with electronic heating devices, but as usual, they smoking classic cigarette with electronic delivery nicotine system. And it's a big problem because we want to know profile of inflammation, but they mix in the type of smoking, and for us it will be different because now we can see that all patients who smoking has a high level of nitric oxygen in the exhale breath in, and it's a marker of the high inflammation. And but now we can say about whole results of our research because we just to start, but in future, I suppose next year we can say about final results of our research research. And at the end, I want to say, get free for your lungs. Thank you, colleagues.
Thank you very much, Marina. Thank you very much. We look forward to completing the number of the 100 participants and to see all these results published. So now we are having the abstract number 13, and I would like to ask Irina Belovalova from the same institute. No. From a National Medical Research Center for Endocrinology to present the main findings of her research. Irina? Okay, if Irina is not here, we continue, and if she joins us, she will be later with us. So now we are moving to abstract number 14. I would like to ask Zamira Radzhabova from the Petrov Institute of Oncology, St. Petersburg, Russia, to give us the main findings of her research. Zamira.
Hello, can you hear me?
Yes.
This is great. So I am going to be presenting on behalf of Dr. Radzhabova because she's now in surgery. I resident in the Head and Neck Oncology Department, which Dr. Radzhabova is the chief of. So a couple months ago, we have started a study that evaluates the incidence of various malignant neoplasm of the head and neck among smoking patients in our department. We also analyze the frequency of development of complications of treatment among smoking patients. We have also set a goal to evaluate the range of nicotine products used by patients, especially putting the focus on the nicotine replacement therapy and the alternative nicotine delivery methods, heat not burn systems and vaping and electronic pods with liquid nicotine inside them. And so we also have set the goal to evaluate the motivation of patients to either quit smoking or switch to less harmful nicotine delivery systems, because we have noticed that the majority of our patients are struggling to do so and are poorly motivated to do so. So we wanted to understand the reasons for that as well and try to develop ways of helping them with smoking cessations, because smoking patients have shown bigger rates of complications of treatment, whether that is surgical treatment or chemotherapy or any combination of treatment methods. So far we have collected information on 47 patients. We have used 3 different questionnaires that evaluate smoking habits, comorbidity, and also the diagnosis of those patients. And so we have found that the majority of smoking patients suffer from laryngeal neoplasms. The second most common location is the neoplasms of the tongue. And the third most common is the parotid salivary gland. As I have already mentioned, most of our patients are using cigarettes. What was interesting that we have discovered is for any psychological help, they haven't used any help. Any books or self-education videos on. You lost the last sentence?
This last sentence.
Okay, can you hear me now?
Yes.
Great. So we have also discovered that none of them used any alternative methods of smoking cessation, individual group counseling, helplines, split lines, books, pamphlets, self-educational videos, any of that. And so we are going to try and implement that into our clinical practice and see how that motivates patients to either quit smoking altogether or at least try and switch to less harmful nicotine delivery products, because most of our patients have a very extensive smoking history, and it's obviously going to be extremely hard for them to quit smoking altogether. So we could at least try and motivate them to switch to something less harmful. So that's it for me. Thank you so much.
Thank you very much, Zamira. Thank you very much. And now we are having the abstract number 15. So I would like to ask Alexander Savin from the Clinic of Evidence-Based Medicine UMCA family to give us his main findings, the main findings of the research. So Alexander. Let's go to the final abstract, which is abstract number 16. And I would like to ask Donald Troy Rhodes to give us the main findings of his research.
Hello, my name is Troy Roach. I'm American, but I work here in Madrid, Spain at Comillas University. And I also work with an international research group called Renegade Research. I'm a citizen scientist, and I'm researching the use of nicotine patches to help people with long COVID and ME/CFS, which is chronic fatigue syndrome. Many people with these diseases, there are no treatments for these diseases, so everybody's just experimenting on their own. And there's very little data on what people are experimenting on, and people just kind of go by what one other person says. So I started collecting data on the nicotine patches because it seemed very promising for me and for other people. And so far, the data has been very positive. There's very clinically significant outcomes. I'd say maybe at least 4 out of 5 see benefits by using nicotine patches. They're using low doses. And those benefits are maybe like a 20% increase in quality of life, which is significant for this group of patients. We've seen a lot of resistance, even from a lot of doctors, because they confuse nicotine, pure nicotine, with smoking. They find it very difficult to distinguish. And even a lot of the research, as many people here know, a lot of the research kind of confounds those two. And then through my research, I also found that there's a lot of neurodiverse people in this population who are suffering from long COVID and ME/CFS. And there's also a lot of research that has shown connection between neurodiversity and cigarette smoking. So I think that if this is shown to be true in future research, then people at younger ages could be targeted to use low-dose transdermal nicotine in order to prevent them being hooked on other nicotine products in the future, and also that might help avoid problems like long COVID and ME/CFS. But if you want to know more, I have a link tree. It's Linktree, the nicotine test. And also I'm looking for any type of collaboration on anybody who are experts on transdermal nicotine, because there are not good transdermal nicotine patches on the market for this population, because most patches are designed for people to stop smoking, and they deliver a high dose at the beginning and they kind of taper off. Whereas for us, we noticed that the cheaper patches, which are thinner and deliver a more constant dose, are more effective. And also some people use less than 1 milligram a day as their main dose, which is a very, very small dose. so they find it very difficult and maybe even dangerous. So
Okay.
help on that would be great.
Roy, thank you very much. I have a question. Okay, you may know that during COVID we have published some papers, a number of papers connecting smoking with COVID and some differences between the populations.
Yes.
My question is the following. Have you any idea if these patches can be useful for the, let's say, vaccine-induced long COVID?
Actually, it's pretty clear from our research that the nicotine patch, or just nicotine by itself, doesn't stop people getting COVID, because plenty of people using the patch have had acute infections. So it's very obvious that it doesn't stop an acute infection. But there is some research on mice showing that it protects the blood-brain barrier, so it helps keep the virus out of the brain, where a lot of the inflammation happens. And especially with transdermal nicotine patches, most of the nicotine actually collects in the gut, in the intestines. And one of the main points of damage that come from COVID, where that actually damages the brain, is actually through the gut and the gut-brain axis. So
but what about the vaccine-induced symptoms?
Oh, well, there are a lot of people in our research. Yeah, there are a lot of people in our research who are long COVID, but with vaccine harm. They have long COVID, but they attribute it to the vaccine, and they also see benefits from using the nicotine patch as well.
Because you know that there are some publications, recent publications, claiming that the so-called long COVID is practically a wrong term, and the correct is vaccine-induced long COVID.
Well, actually, most of the people who have long COVID, actually the biggest cohort is from people that got long COVID before the vaccines even existed.
Okay.
And there's a lot of people who haven't been vaccinated as well. And
With
actually,
long COVID.
there's actually a slight difference between the symptoms between people who have vaccine-induced long COVID and people who have long COVID from the actual infection. And also, ME/CFS has existed for forever, for decades, long before even vaccines existed. So, yeah.
Okay, Troy, thank you very, very much.
Okay, thank you.
I would like to ask once more Alexander or Irina, if they are here, to present the abstracts. Or else, I would like to thank all of you for keeping the time, giving us very well the main message, the take-home message of your presentations. And I would like once again to ask the audience to visit the on-demand part of the website and to see what is happening in the research that all of you have presented just before. So thank you very much, and looking forward to meet you all again in a live conference. Thank you very much.
Thank you.